Well, the concern is that taxpayer funds are being used really in an advocacy way and not giving a full picture of what this new Medicare law will be. And if you look at what official government evaluators of the bill, whether it's the Congressional Budget Office, CBO, or whether it's the actuaries at CMS, Center for Medicare and Medicaid Services, they're all saying that seniors' benefits are in jeopardy under this bill, whether it's because they won't be able to find a doctor or because Medicare cuts are going to take place and really hurt the quality of care they're going to receive. But that doesn't find its way into the mailing. We just find the good news, and I think it should be a more objective, more even-handed approach to those issues. Well, I can't think of a process that was more flawed than this one. If you look at accountability, transparency, it just wasn't there. You had a bill pretty much written in Senate Majority Leader Harry Reid's office and then brought to the floor a few days later. The idea that citizens have an opportunity to come before their government and tell them how laws are going to affect them in open hearings, it just didn't happen. And finding out information about the bill was very difficult. Certainly, it was a process that was flawed from the beginning. I hope we can get standards that say legislation has to be in public domain and be read before it's voted on. We had major changes at the last minute, and as a result, both the Congressional Budget Office and CMS had to issue incomplete reports on how the bill might affect healthcare spending over time, how it might affect the number of insured, how it might affect healthcare premiums. They gave us partial letters, and we're going to get a final report from CBO just, I think, at the end of the month, in early July, on what the healthcare bill means for long-term healthcare spending, the budget of the United States, those big issues that we should have had before there was a vote on the bill. Mm-hmm. Well, the role of the IRS is unprecedented under this new healthcare law. They are going to be the enforcers of whether or not people have quote-unquote acceptable health care. And that is a new role for them. It's really not a function that the IRS is able to do well, but they're going to be monitoring whether people are getting the right health care. They'll have to hire tens of thousands of agents in order to complete this. In fact, we have estimates as many as 16,000 new agents in order to fulfill their obligations under the new law. It's a major role for the IRS, it's unprecedented, and I think a role that they're not suited to perform. Again, the small business tax credit is portrayed as really giving a break or a helping hand to small businesses. They have new mandates under this law and requirements to provide health insurance, and certain kinds of health insurance is defined by the federal government. But what this health care tax credit does is, if you evaluate it, only applies to 10% of small businesses, and it phases out. So it's going to be temporary help that really doesn't meet the billing. And so while we get mailings that say how great there's a small business tax credit in the bill, they really don't say what in effect that will mean, and what it means is 90% of small businesses won't qualify. Well, this is part of the burden on employers that's going to result from this bill, and I think it's going to be a huge unreported expense, or a big unfunded mandate, if you will, on all the small businesses. They have to report every expenditure that's over $600. So that means, for example, if a small business flew to 2 seminars, they'd have to send a 1099 to the airline company that they used. It's going to be a massive paperwork increase for small businesses, and it's going to make it much harder, particularly for businesses that have really tight margins, to continue to operate, because they're going to have to keep track again of a whole level of spending that they didn't have to keep track of in that way, and send 1099s to people they routinely do business with. I do. I think it's really telling that 20 states have joined the lawsuit, including the largest representative of small business in the United States, the National Federation of Independent Business, NFIB, has joined the lawsuit as well. Never before has the government ordered Americans to buy a product, and never before has the government taxed people for doing nothing. And so I think both of those issues are important legal issues that need to be resolved. I think they'll go all the way to the Supreme Court. And the fact that so many states have joined that lawsuit, I think just points out how a lot of people believe they have merit to the constitutional challenge to the mandates that are in the health care bill. It doesn't reduce the deficit, and the law doesn't reduce overall health care spending. You often heard we need to bend the cost curve. That meant bend the long-term spending on health care downward, reduce it. This does the opposite. This increases the long-term health obligations because certainly increasing Medicaid, adding new entitlements. The way the entire bill is structured, it's going to raise costs for individuals in terms of their premiums. It's going to cause the deficit to get bigger because of the mandates that are in the bill, particularly the Class Act, which is an unfunded brand new entitlement they put in the legislation. And so it's not going to meet the goals that the president set. There also are other ways that the bill falls short. It raises taxes on people who earn incomes under $250,000. And that is, again, another promise that was made in the bill that isn't going to be met.